Absolutely. You asked what people can do to advocate for themselves, and all of us in the world of healthcare advocacy, I can speak for all of us and say that our mission is to really help individuals to advocate for themselves in this complex healthcare system. And so just some really simple things that I hope my clients all do after they work with me. Number one is to really try to develop a really good relationship, not only with their primary care physician, but with their primary care practice. We all know that as healthcare is changing these days, the delivery of healthcare, especially primary care, is shared very often with a team. And so I think it's really important that you develop a relationship with your primary care physician by actually bringing the topic of our relationship up as an agenda item when you meet with your primary care physician. So you can talk about how you're going to communicate, both while you're in an appointment together, but what about in between appointments? So that you can share how you best like to be communicated with and your expectations for communication. I think you should also do that with any other member of the practice. So if there's a nurse practitioner or a physician assistant or a medical assistant or a social worker or a PT, because these days primary care practices are really expanding. Again, trying to meet all the members of your team so that you have a good relationship. One of the other major things that I hope all of my clients do is to prepare for any physician appointments that they might have. And I suggest that they use a business tool. I suggest that they use a formal written agenda, and that agenda should consist of what their objective is for that meeting. What is it that I hope to accomplish today? And what are the specific agenda items that I'd like to discuss? So if I want to discuss the preventive health care, do I want to discuss how my diabetes is being managed? Do I want to discuss a referral to a nutritionist? So you list your agenda items and then you list your very specific questions. And I always suggest that my clients actually say to their physician at the beginning of the appointment, I just want to let you know that I spent time preparing for this visit. I prepared a written agenda, and I'd really appreciate it if you took a look at this agenda so you could see what I hope to accomplish. And if we need to modify it based on what you'd like to accomplish, let's talk about that at the beginning so we reserve time to discuss all the items. This is very, very empowering to a patient. It really helps them to gain control of that meeting and realize that it is their meeting, and what the effort that they put into it will really benefit them, because they'll really have a much more satisfying experience when they walk out of that meeting, summarizing what it is they discussed and what the next steps are. I find that physicians really appreciate this as well, because you've really put some thought into it, and they are very engaged in such a process. So I think it's a win-win for everyone. Can I just make one more point? The third thing is that I think we all need a care partner. We all need to bring someone with us to appointments. There's a lot you might go over, and if you really want to be an active listener, you can delegate the responsibility for the scribe to be your care partner. And your care partner can be thinking about the discussion as you're going through, and maybe at the end you could ask them if they have any questions that they have through the discussion that didn't get addressed. So I think those three things would be what I would suggest to people.
Diane, thank you so much. That was brilliant. I really appreciate your time. I know you're very busy, and I'm so grateful to have this interview. Thank you so much.
You're very welcome.